there. Hello. You found me. My name's Ginger Curley, and today's conversation is going to be on Medicare A and B. In the future, I'll also have some more videos I'm adding on Medicare C, Medicare D, Medicare supplements, how they work and how C's work and what actually works better for your circumstances. Just a lot of different subjects on Medicare and financial products. I've been thinking about doing these YouTube videos for a long time. I've been in the business for 15 plus years, and I just can't tell you how many times who put this person on this plan? Why didn't they take this out first? So I want to help you make sure that you do things right. There are some rules, but done right, it can be really, really a good thing. Okay, now, like I said, I'm going to talk about Medicare A and B, and like I also said, I'm kind of new to the YouTube as yet, and so I got myself a couple of notes here. So if you see me looking down, that's what I'm doing. I'm double checking, making sure I don't misspeak. But the first thing I wanted to show you is I got this. Let me see if I can show it to you. See there, I got John's Medicare card. No, I didn't. It's a Medicare supplement card. It's a sample of a Medicare card, I should say. And I found it on the internet. And I want you to look at it and see. You'll see that it says the guy's name. And then there is a member ID number. It's an 11-digit number of A's and B's and all sorts of letters and numbers. And then it's also got hospital, Medicare Part A, medical, Medicare Part B. So you see there, it tells us right away what Medicare covers. So hospital Part A is the portion of Medicare that is going to cover your hospitalization expenses. And Part B is the medical and outpatient coverage of Medicare insurances. So we know the what, hospital and outpatient and medical. So how much do they cost? Don't all hardworking Americans get it for free when they turn 65? If it does have a cost, do I need to take it out? When do I need to take it out? Okay, all good subjects. So I'll try and keep that ordered. Try not to go all over the place so you get confused, or I confuse myself. I have a tendency to kind of go, ooh, shiny object, and get distracted sometimes. So I did want to cover, first of all, what, then is it free, and like that. Now we've already covered the what, so is it free? If you have worked and paid into the Medicare insurance tax for 40 full quarters, 10 years, then when you turn 65, you qualify for Medicare Part A premium free. However, that Medicare insurance tax does not cover the rest of Medicare expenses. The Medicare Part B comes to you with a premium based on your income. As far as the when goes, when you turn 65 or 2 full years after you get disability, or in some cases earlier, like in end-stage renal disease, it comes earlier, then you qualify to get Medicare. Now, if you have, say, COBRA coverage or group coverage, whether it be from your own or your spouse's, if you've got coverage that's at least as good as original Medicare, you don't need to take it out if you don't want to. But your best bet is always to speak to the human resource person that helped you get the plan you're on. And they'll tell you if it's at least as good as original Medicare. And even if it is as good as original Medicare, what some group coverages recommend people do, go ahead and get your Medicare. And then that way you can lay that down as the primary And then you'll put your group coverage on as a secondary, and then everything's taken care of. You know, all insurances have co-pays, deductibles, co-insurance. And so, same thing with Medicare. So, give it a real consideration, even if you don't have to. Now, what do I mean about you don't have to, or you do have to? I don't have to do anything. I was born, and someday I'm going to die, and everything in the middle is choices. And what I mean is there are consequences to some choices. If when you turn 65, you're still in really good health, but you've not got any coverage, and you think to yourself, I'm healthy as they come. I'm not going to worry about that. I don't want to have to pay $150 for something I don't need. Well, I'd like to put a couple things in front of you. First of all, you're only healthy until you're not. What I mean is sometimes someone has something lurking underneath that they're not aware of. And then all of a sudden, blam, they're in the hospital and they're having all sorts of issues. And the doctor's telling them they're lucky to be alive. And they're going, I guess I wasn't as healthy as I thought I was. And you don't want to be caught in a situation like that and not have the coverage. But more than that, if you don't take the coverage when you were eligible to do so, and then later decide you want to go and get the coverage, Medicare's going to be looking at you going, but you were eligible to do this before. Why did you not do that then? If your answer is anything except I had coverage at least as good as original Medicare, so I didn't need to, what they're going to do is they're going to say, okay, well, you can apply, but the only time a year you can apply for it will be January 1st through March 31st. And then you'll get your Medicare Part B effective July 1st of the same year. And at that point, they're going to charge you 10% extra for every full year you went without Medicare Part B that you could have had Medicare Part B. Now, the Medicare Part A, you can apply for that anytime after you're eligible. There's no particular enrollment period. And like I said, if you worked 40 full quarters and paid into the Medicare insurance tax, then it's going to be premium free. So if you're working along and you let that date go by and you keep going and sometime later you're like, wait a minute, I never got my Medicare card. I thought when you turn 65, they automatically send it to you. Then you could get a hold of Medicare and say, hey, I didn't get my Medicare card. And they said, we see you did not. You did not apply for it. Okay, well, I want to apply for it. When you apply for Medicare Part A, anytime after you're eligible, you can do this. And they'll make it effective, retroactive, as much as 6 months back. So if it's like 3 months after the time you should have applied for it, it'll go back to your birthday month, just the 3 months. But if it's 7, 8 months, a year, it's only going to go 6 months back from the date you applied for it. Okay? So Medicare Part A covers hospital. If you worked or if you're drawing your benefits from a spouse that worked and paid into the Medicare insurance tax for 10 full years, it comes to you without any further cost. And actually they say, let me see if I have the exact numbers. Yes, I do. If you work more than 30 quarters but less than 40, the premium for Part A will be $259. If you work anything less than 30 full quarters paying into that Medicare insurance tax, the monthly premium would be $471 for Medicare Part A. And Medicare Part B, that premium, when you take it out, is $148.50. Unless you let it go and you take it out late, then there's that 10% fine for every year that you could have taken it out that you didn't take it out. Okay? But now that fine only accounts if you didn't have another coverage that's at least as good as original Medicare. So no, you don't have to take Medicare A out. You don't have to take Medicare B out. But if it's going to come to you free, why wouldn't you get your Medicare Part A? And as far as B goes, if you have COBRA coverage or group coverage or any coverage that's at least as good as original Medicare, still speak to the HR person. They may point out that it's a good idea to go ahead and get it anyway so you can use it as your primary. But it's up to you. As long as you have coverage at least as good as, when you go to apply and they ask you, why didn't you take this out when you were eligible to do so? You could say, because I had other coverage. And here's my letter. And it shows the date I had it from and to. Now, when it expires, you only have a little bit of time to get in there and get it taken care of. So you'll want to do it right away. Okay? All right. That's Medicare A and B. Yep, we're good. We're good. Unless you want to know what the cost is once you have it. Medicare Part A, the way that one works, once you have it, if you landed in the hospital and all you had as far as coverage was your Medicare card, Medicare will cover everything except a $1,484 deductible for the first 60 days. And then after that 60 days, it's $371 per day for days 61 through 90. And when you get to day 91, you start dipping into your lifetime days. Everyone gets given 60 lifetime days for the course of their whole life. And these lifetime days at present cost $741 per. Now, as far as the Medicare Part B goes, if all you had was Medicare Part B to cover your outpatient and medical expenses, say you went to your doctor's office the first time for the year, there's a $203 deductible. After you've met that $203 deductible, the Medicare Part B deductible, then the rest of the year, there's an 80-20 split. 80% on Medicare and 20% on you. And so that's where people start saying, oh, well, that's pretty good, but still, what about all those co-pays, co-insurance, deductibles that aren't covered? Shouldn't I get a supplement? We're going to be talking about that real soon. But a real important one to talk about before then would be the Part D. So go ahead and click subscribe down below. And if you have some questions that just can't wait and you got to talk to me, my contact information down below. And otherwise, yeah, my next video is going to be on Medicare Part D, and the one after that will be on supplements. Thanks!